All right. Good morning, everybody. Thank you all for joining us on this Wednesday morning. My name is Ben Groves. I am a sales broker advisor with Insurance Advisors Direct. Today, we are going to be talking about Trusty Care and all that it can do to help you not only save time as AEP, but also stay compliant with these new laws from the SMS. This webinar is being recorded and can later be found on our YouTube page. Any questions, please put in the chat and we're going to answer them as they come, or at the end, we will save some time for some questions. So without further ado, I'm going to kick it over to Allison and Clayton. So take it away, guys.
All right. Good morning, everybody. So like Ben said, we're going to walk through our platform, which is Trusty Select Pro. We're going to do an end-to-end walkthrough and highlight all of our new functions. So we're going to show you your producer profile and dashboard, getting started, entering in your beneficiaries, so getting their profile set up, and then moving into adding their medications. We do have a new medication entry. So if you've used Trusty Select Pro in the past, we used to use unit dose pricing, but now we've moved to package pricing. So we think that'll be a lot easier for everybody when you're entering in those medications. We'll move into running some quotes and how to compare them. We added a few new features to that area. So we now are including the senior insulin savings pricing in the plan comparison. And then also if there's a Part B give back. We'll show you how to make sure you get your scope of appointment on file. We do have a process called batch processing, and that's how you can run in big groups plan recommendations for your clients. We'll show you that. Clayton can touch on direct enrollment. That's new for us. Again, if you use Trusty Select Pro in the past, we used to have DocuSign, but now we have partnered with Connecture, and so we're using their just the very final process. Just the direct enrollment portion will be linked into their back end. We'll also go over call recording option that we have available. We have a partnership with Ring Central, so Clayton will show you that function. And then at the end, I'll wrap up with some training and resources. We've got an onboarding site and a customer support portal. So like Ben said, I'll be monitoring chat the whole time. So if you've got a question that you want to throw in chat, or if you want to come off of mute, if we're still in that section, then you can absolutely ask your questions as we go. We've got plenty of time. This is just a one-page high-level overview of the quoting and enrollment process. So again, just getting your beneficiaries added in, getting all their medications updated, running your quotes, making sure you have your scope on file, and then your direct enrollment. This is just a good overview. Sometimes I get people that will reach out to me and say, I'm in here, I'm logged in, but what do I do? Just not knowing where to start. So this is a great just one pager for that. This is the support portal that I'll show you. This has our whole Trusty University on here. So this is access to all of our training videos and knowledge articles. You'll also have during AEP, we've just turned it on, a chat option where you can reach out and chat with one of our support analysts, or if they're not available at that time, then you can open up a support ticket. I'll also walk through this, which is your agent onboarding site. It's basically just like a quick start guide. It has the same type of information as the other site, but it's more geared towards just getting you started. It doesn't have the whole depth of training on there. All right, Clayton, move it over to you. We can get started.
All right, let's do this. You guys ready to have some fun? Yay, we're learning Trusty. It's going to be fun. Okay. Am I on mute?
No.
Okay. All right. So the very first thing that, well, if I can get all these messages off my screen, the very first thing you come to is the login, of course. You can put in your login information, brings you into the system, and you see the beneficiary list. And this list is a compilation of all of your clients, your book of business as a whole. We're going to talk about that here in just a minute. What I really want to do is go through the whole process of adding a beneficiary, adding the medications, and then moving into the enrollment. I will say the enrollment we have, it's taken offline so that we can prepare for open enrollment, which who's counting 10 days away. But so I can still show you some pictures and kind of how the process works. I just won't be able to show you the application form itself. So let's go in here and add a beneficiary. Okay, so I'm going to click on add beneficiaries. We have 3 options now. We can download a Trusty consumer template. What that is to bulk upload all of your book of business. So you can take up to 5,000 at a time and bulk import them into Trusty, and then your clients will automatically show up in here for you. We can help you with that if you want to. I'm not going to touch on that during this training at all, but I do have a video out there on our university to help walk you through that if you want to do that. The single beneficiary is what we're going to click on. And this brings you to a form where basically what we're doing is creating a profile that we're going to be able to access at a later time. So I'm going to pick on Ben. Ben, what's a good zip code up there where you're at?
48375.
375. Okay, thank you. Now, an important thing here, as you guys are using the system, you're probably going to want to play with this a little bit and enter in some beneficiaries just to test with. I will tell you, don't use a fake email if at all possible at all, because what that does is it will count towards the spam number for Trusty, which means your beneficiary, that number grows to where that email ends up when you send stuff out of Trusty, and it'll go to their spam folder. It's just an Amazon Web Service thing. Every vendor that uses AWS has that, and really anybody. So what we do to get around that is they have provided a mechanism to let us do that. So what we do is we do Clayton and then the plus sign, and then I do first last name at trusty.care. So that is my actual email address, clayton@trusty.care. But what I'm doing right here is I'm tricking the system to allow that to think that it is a unique email address, and then it will actually go to my email address. So just a little tip there for you. The date of birth, pretty self-explanatory. Let me just enter one in here. The gender and tobacco use, that's for the MedSup, of course. We don't know what you're going to be doing at this point. We do require that just to be captured so that we can run the quote later. The income range, we do pull that in as well. And that is not just a feature that just says, hey, this person is within this range. We actually take that chart that usually you have to do manually and calculate it, and we bake that into the premium. So 500,000 and above, let's say it's like what, 77 something, I don't know right off the top of my head, but that IRMA adjustment would be added to the premium, which then affects the overall cost. So that is kind of a neat feature as well. Then they're getting a pretty close picture on what it is that they're going to be paying for that particular plan. The current plan, you can select a current MA or PDP plan simply by clicking that button. These right here will just show you what will be displayed when you click that button. So PDP, it's only going to show PDPs. Okay, I'm going to go ahead and just select one of these at random, and then save and continue, or you can always hit save and quit if you want to just create a profile. Okay, the pharmacies is based on the zip code of where that pharmacy is located. Excuse me. If it's like Los Angeles, for example, where you can have a pharmacy on one street corner and then right across the street there's another pharmacy and it's 2 completely different zip codes, then I just lost my train of thought. Yeah, I don't know where I was going with that. So you do have to make sure that you have the zip code for the pharmacy you're trying to put in. So I'm going to put in Walgreens, and that is a radius of 10 miles. It is a dynamic radius. So if you have somebody that lives out in a very remote area where there's probably only going to be one pharmacy that pulls up, What that will do is it will dynamically expand out that radius to pull in more pharmacies automatically. You can select as many pharmacies as you want to. And notice when I put in those characters, it's going to search first on those characters for, in this example, I did Walmart. And then it's going to list out all the other pharmacies that are available within that zip code as well. Okay. So we'll select Rite Aid in there too. The doctors, we are searching based on where the doctor is registered. And it is a search string of, if you put in HUN, it's going to search the first name or last name for those letter combinations. If you don't know the zip code of that particular doctor, for example, if that doctor has 5 different clinics around the area in a couple of different zip codes, what zip code do you need to enter? Well, don't Google that. It's going to take a while for you to Google, and it's really not specific as to which one they're registered in. So what I usually do is I'll put in a search here. I open up a new tab, and then I look right at the NPI registry. Where did that doctor register? So Allison is probably going to put this link out there in the chat for you. And this just brings up a search page for the NPI. So Ben, do you want to tell me a name of a doctor, or do you want me just to pick one randomly?
Dr. Paul Jackson.
Okay, so I'm going to type in Jackson. We'll type in Paul, and I don't want the zip code or anything, but we're going to put in the state. And then I'm just going to hit search. There it is, Livonia, Michigan. Oh, Livonia. Is that where you're at?
Close. We're in Novi, next door.
Okay, I did some work at a hospital in Livonia before they had that new hospital that went in. Interesting. Okay. Then I'm just going to grab that zip code and come back over into Trusty, this one, and put that zip code in there. And then I can search for the doctor I'm looking for within that zip code. I'm just making this up now. Okay, there's Dr. Gilbert. That's the one that I'm looking for. Oh, wait, no. Sorry. Who was that doctor, Ben? Who was that we looked for?
Jackson.
Jackson, that's right. Sorry. You would think it's a Friday. Paul Jackson, there it is. Okay, so pulled him up. And there is no maximum or limit to how many doctors you can put in here. You can put in as many as you want. The thing that we don't do is if you put in like Banner Health System, we don't have the groups where it's going to list all of the doctors associated with that group. We do have, however, if you type in let's see, chiropractors, it's going to list the chiropractors associated. And let me see, cardiologists. So there's your cardiologists. So it's going to pull them up that way as well. Now let's talk about drugs here for just a moment. I'll just add another doctor there. I'm going to click on add medication. And I'm going to search just for a tablet right now to show you. I'm going to try to show you each form. And this, you have to have at least 3 characters to start this search. And the form is going to be tablet. The film coded are those really annoying things where you have to try to push the tablet out. And then your dosage, your quantity, and then of course your frequency. Pretty self-explanatory with the tablet. Once you enter that, you're just going to hit add medication. I want to add another one, and I'm going to type in Zidra, which is an eye drop. And the form on this one is going to be a carton because it comes in those little ampule, or not ampules, those one-time use things. And so it comes in a carton. This is a 5% dosage. And the carton comes in 4 pouches or 12 pouches of those little eye drops. So then I'll put in 1 because I want 1 package and every month. Add medication. And now I want to put in a insulin so I can show you how that works as well. So let's do, what is it? Lispro. Let's do that one. The form, you're going to have syringe or vial. Say syringe. Package, it comes in a 3 ml or a 10 ml. We'll say 1 every month. Add medication. Okay, so all of my medications are now entered, and I'm going to click next to begin the quote process. If I wanted to, I could just hit save and quit if I wasn't ready to run a quote. This now is going to show all of the plans that you are able to quote for. Ben, are you setting them up to quote for every plan?
Yes.
You are. Okay. So everybody will have by default all of the states that you have that you sell for. Ben's going to have that set up as to let you quote for everything. So in this example, we have 23 results for the prescription drug plan. If I want to narrow that down, let's say the client that I'm talking to, they really had a good experience with WellCare and they just want to stick with WellCare again, I can just narrow that down to WellCare. It takes off every other plan, and then I'm just looking at those two. If I wanted to look at the pharmacy, so pharmacy is super important for them, I can go in and I can say, okay, Walgreens, but I only want preferred. Notice how that took one of those off because one of those plans is not standard or preferred. But now that I say I want preferred, now it's only going to show me 11 results here where that particular pharmacy is in network. Okay, same thing with Rite Aid, preferred. And then now basically what I told it is I have to have a plan that has both of these in network preferred. If I uncheck Walgreens, there you go. Now it's just Rite Aid. That's how that works. So the first thing I want to point out here is there's a label up here at the top that says Part D Senior Savings. This right here indicates that this plan has an insulin benefit. It doesn't, at this juncture, it doesn't matter if I have an insulin drug on the plan or not, or in the profile for the beneficiary. This is just at the plan level. All of these plans are sorted by the estimated out of pocket and plan premium. You can see how that gets bigger. It's not the premium, what you would think. So with our Part D Senior Savings, it's baked into the cost. So that means this one might fall up towards the top, whereas some of these other ones that you would think would be cheaper are actually not. Because of that. So let's dive in and take a look at that, shall we? So we have view details. And this particular plan, it's going to have everything listed across the top. And I love this view because it's just one screen. I don't have to scroll through everything trying to find what I'm looking for. The IRMA adjustment is right here, but then you would also have that indicated in the monthly premium, whatever that IRMA adjustment would be. I didn't pick one, that's why it's 0. The tier cost overview, excuse me. This is the tier cost for that specific plan. It changes based on what that plan is, as you know, but this is going to show you all 5 of those. The oh, I picked one where that insulin is not covered. Hold on, let me go back. Drugs covered 2 of 3, 2 of 3. Maybe this one has. Okay, I'm striking out. Let me go back and pick a different one, a different drug. Hold on. I really want to show you that. So what I just did is I went back to the beneficiary list. I'm kind of out of order right here, but you click on the name of the beneficiary, and this is that profile we just created. And I'm just going to click on drugs, and I want to add. Is Humalog usually one that's...
You usually use Humalog and keep it. Mm-hmm. Either that one or Ozempic.
Is Ozempic the inhaler?
No, it's another insulin.
It's an insulin? Okay. Clay, you need to get up with your medications. Oh, no. All right, let me take this one off. Okay, let me run that quote again. And there we go. Good job, Allison. 3 of 3 covered. So let's view the details of that plan again. And notice I have a tier 6. Well, what that tier is it's a specialty tier that they are using Only 1% of the drugs have that in the past, but this is now being used for insulin as well for some plans. So if you see that, that is a real tier that they're bucketing those into. And you can see quickly that this has senior savings available. And then what we do is we take that $11, which is that price that they are giving for that particular insulin benefit. Okay. And all of that is baked in. And so the cost up here is going to be what the monthly will be for those particular medications. We do have the doctors that show up here. I know the PDP doesn't really have doctors, but this view details page is a clone of the Advantage plan. So the pharmacies, this will show you preferred or standard or not covered in there as well. If you do want to view standard pricing, you can. By default, we search on preferred pricing for everything. So we're going to default that to preferred, but if you want to flip to standard, you can. You can see how everything changed, the tier cost, and then the monthly changed as well. And then, nope, the senior savings is still the same. If you want to, you can print this or you can email it to your client. And then this will just take this screen and button it up and then mail it to them. It does look like when I print it, this is what it looks like as it goes out to them. I know it's hard to see. I can't scroll in. It will list the pharmacies and then the tier structure. And then you're going to have the preferred pricing. And then you have your standard. In this report, we also included mail order, standard, mail order preferred. Okay. And you can save that. You can print it, whatever you want to do with that. Any questions coming in on this so far?
I don't see anything.
Okay. And we have a smaller group, so feel free to come off mute and just interrupt me at any time. You're totally fine doing that. I actually like interaction. If you want to compare plans, what you're going to do is click the box right here, and then you can compare plans. We can only do 2 plans at a time right now. We are looking at doing 3 for future release, but right now we only have 2. Excuse me. I'm boring myself, Allison. Sorry. I hope I'm not boring everybody. The compare plans here just pulls the information in side by side. And then you have your pharmacies and costs, your estimated monthly cost, and then your monthly cost breakdown for those particular drugs. And let's see, you can print this and send this as well, just like we did on the other. And let's take a look at the Medicare Advantage plan now. So I just clicked over here on the right, and that is going to show me all of my Advantage plans that I have available to me up there in that particular zip code. I can, again, do the carrier or the plan or the pharmacy, but I also have plan type. So if I only want PPO, it's going to take and pull off everything else but PPO, so on and so forth for that. Same thing with my SNPs. If I want to search for just the D SNPs, there's 12 available to me. And then the doctor coverage. This is a really neat functionality here. So right now I can't click on those because I have to activate them. So how I do that is I click get coverage info, and that's going to go out and grab that. And then I can select these. So let's look at Paul Jackson. Paul is in network for 49 of these Advantage plans. Okay. Dr. Hung, 18. And Dr. Cardozo, 43. If I am one where I have to have all of these because they're specialists that I go to, and I can't not have them on my plan, I can select all of them, and then it takes all of those, and I'm basically telling them all the plans that have all 3 of these. Can you still hear me, Allison?
Yes.
Okay, I just had all that stuff flash on my
screen.
So I'm telling the system that I have to have all 3 of these doctors in network for these plans, and that's where it's going to pull out and show those to me. We do have, if you notice over here, Part B give back available. That is a really cool thing, because some of these plans you do have a give back, and that might make sense for that particular beneficiary to go on that particular plan based on what that give back is. So we can't view that right here on the card, what that give back is, because it is the Part B level. So if we want to, we can click save. And then on that plan, brings us to a plan recommendation page. And then there's our Part B give back. So this one, they would be getting $30 back of that 170. Okay. Any questions on that? Okay. On this screen too, you can also click the get doctors list, and this is just going to tell you how many doctors are in network or not. Hover on this and then it will tell you all 3 of these are in network. Okay, so you can just hover on that and it gives you the list. If you do want to get back over into the compare plans screen again, you just click compare plans, and that's going to bring you over to this screen again. If you have a plan that has direct enrollment available, Allison mentioned that we are working with Connecture for our direct enrollment only. There would be a tab up here at the top, or a label kind of like this, but it's going to be green, and it will say direct enrollment available. Right now, we are 10 days out from AEP. Clay, will you stop reminding me? I know, but 10 days. So that means right now we have it shut off so that we can do the refresh for 2023 for all of that. So I actually can't show you how and go through the actual enrollment process, because plans and stuff, and we're doing a lot of things to it for 2023. That will be coming out on Tuesday though. So we're pushing really heavy for that release on Tuesday evening at 9 or 10 p.m. Eastern time. Let's see. Compare plans. So I do want to touch on this because it's a question that comes up every now and then. Again, you can only compare 2 MA plans, MAPD. I'll hit compare, but it does not compare the benefits side by side. That's something that we have as an enhancement. Right now, it's only showing the drug comparison, just like the PDP. So I wanted to point that out. Okay. All right, so I'm going to save this plan. If I wanted to do a PDP, I could from this particular screen. So there's my Advantage plan. Here's my PDP. Now, once I save a PDP, so by default, we select one for you as just a recommendation. It's not one that you have to go with. It's just the Trusty selected plan. And that's based on lowest estimated out-of-pocket highest drug coverage. If you wanted to have a different PDP plan, again, just hit compare plans. Once you do that and you save a PDP plan, now you can go and you can do a Medigap supplement. It's the only way you can get to this part right here. You can do a search by the plan type. I'm going to click run a Medigap quote. We do use CSG for all of our backend data for this. And this is going to list every single Medigap supplement in that particular zip code that I'm in. Well, that's a lot to scroll through, Clay. Yep, it is. However, you can filter these out. Excuse me. So edit that out of the video, Allison. All my yawning. You can filter these by issue age, community, attained age, rating class, so on and so forth. And when I do issue age, it takes all the others out and it just gives me those issue age. The one thing that I will point out, that if a plan has an EFT discount, then that discount is reflected in this price right here. There is times where I get a question, Clay, this plan is not the same price as when I go to the site. Well, it's a little bit less. Well, that's because we have the EFT discount showing. So don't be alarmed. That's just kind of what we have there. The view details, this is going to show you the other benefits. So foreign travel, and then you have your hospital, and then you have your medical, and then both parts A and B, the DME, and then the home health care. As part of that, you can print this and send this as well. I'm going to go ahead and just hit save this plan. And there it came back on that screen right there. Okay. I will go ahead and click save. Oh, the broker portal. I always forget to talk about this. All this does is it takes you right back to this particular carrier site if we have that link. So Mutual of Omaha RX Premier. If they have that, then we will have that there where you can just go back to right into the site where you can log in as a broker. Save this, and then now it's going to bring that back here. The plus sign indicates that I have a Medigap supplement on that plan as well. If I didn't, it would just show PDP. So now that I've created my profile, I've gone through and selected a plan. Let me touch base on the profile, or not the profile, the beneficiary list. So this will, as I mentioned earlier, house all of your beneficiaries. The one thing I do want to point out quickly is the lead status. So these are manual. You can change these to in progress, closed won, closed lost. And then as you do that, you can come in and say, okay, on this list, I want to filter and only show me in progress, but I also only want to work on PDPs today. So now I can stack those filters, and then I can plan my day and I can work through those as I do those. See how it moves it off my list. So it's kind of a cool way for you to kind of help work through that, during AEP. You can filter these out. You can stack as many as you want on those. It's not restricted there. You can also sort all of these fields. They have little hamburgers next to them. You can sort ascending or descending. I think I'm running out of oxygen, Allison. I talk too much. I'm just kidding. The application status, as you go through the application with Connecture, what you're going to have here is the actual status code here. Now, in my onboarding site that Allison's going to talk about here in a little while, this one here, I actually have the definitions of what those are. So if you send something to a beneficiary, it's going to say waiting for the beneficiary. If you have submitted it, it's going to say submitted. If it's in progress, it'll show in progress. So you can see what's going on with that application at all times right here on the screen. It is not a field that you can manually do like this one. It is all pulling from the actual status of that particular enrollment application. The actions menu here, this is where you can email your client. You can add a document, you add a note, send a scope of appointment, or this is that enrollment button. That enroll button will only show if you have a quoted plan saved. Okay. And that doesn't mean it's only going to show if they're digital direct enrollment available. That's the only criteria for that to show, is just that right there, to have a quoted plan. The email, if you click on email, it's not where you can actually just free type at this particular moment. You can, if you click custom, you can free type your own, but it's not a template that you can create a template and then at mass send out to everybody. That's not how the custom works. This one, it's strictly just that. It is just a form, just like your other email. The idea here is to eventually get to where we can have our own templates and stuff, but this particular feature is just for that. You can just send an email from there. Let me see. Let me get out of that. Hold on. There we go. I think I just found something that we need to write up, etc. All right. So the medication update, this is the update email that goes to the beneficiary that you selected, asking them to conduct their review, do a blue button import, and that way they can get ready and update you for what their medications are that they have. The blue button 2.0 authorization, this is a power of attorney, a limited power of attorney that gives you the ability to create their mymedicare.gov account for them or to do a blue button import on their behalf. This is through DocuSign, so they can sign it from their phone, etc. I sure wish I had a glass of water right next to me. The instant plan and RX review, I'm going to talk about that. That is the batch results. You can send that out again if you want to. The other way that you can send that email out, the medication update, asking all of your beneficiaries, hey, it's that time of year. Let's get in here and update your medications. Right over here on the left side, you have these little check boxes. You can check off a few, or you can check off all of them. And I have 3,856 selected. Oh, that's a lot of clients I got to get through this AEP. Holy smokes. And then I'm going to click email. Once I do this, that email is going to go out to every single person. We have 2 stops though, right? So once you click this, don't worry, it's not going to go out yet. It's confirming, are you sure you're ready to send this, requesting their information? Yes or no. So when you hit send, boom, it's gone. Okay. So that's how that works. Let's see, anything else on the beneficiary list that I missed, Allison? I think I got everything on the list.
Yes, I think that's right.
Okay, let's go back into Ben at this point. So I'm going to click on his name here, and that brings me into the profile. Right away, I want to start from the left and kind of go to the right. So this is all of the demographic information for Ben. I can click on edit and put in the phone number. I can put in the street address if I want to. Let's see. And there's no Santan Valley in Michigan, but we're going to pretend that there is. And save changes. And there's that information stored there. That will feed over to the enrollment application as well. Anything we put in here will feed over. Clay, where's the MBI number? I don't see that. Good question, Clay. That is actually going to be coming out Tuesday, where you will have that show up right here underneath date of birth. Okay. The effective date, tobacco use, if you want to edit any of those, you can. The blue button will pull in the hospital Part A and Part B effective dates. Excuse me. And then down here in the middle, we have the plan, the quoted plans, and then your current plan. So here's our Medigap, and then here is our PDP plan. If you wanted to see the details of that plan, just click see more, and then click the back arrow when you're done. Same thing with the Medigap. The current plan that they're on right now at this very second, you don't have the ability to add or edit, but Tuesday, we're releasing that ability to allow you to add or edit that particular current plan. The notes, you can add any notes you want. This is truly like a CRM. So I can put in medications. So don't forget medications, save the note, and then that will save right there in their list. You can filter this also by this month, all, or this week. Document repository. That always scares me when that comes up. Document repository. We can upload any documents we want, drag and drop, or load up what you want there. Okay. So there's that file. And when you click on it, it's going to download it again. And then it will open up for you. Okay. But this will store the retention policy on this is 10 years plus the current year. And then if you want to edit your pharmacies, you can. Excuse me. Holy Hannah. The add more, you can click add more, and then you just start typing right here on that blank space, and then you can add more pharmacies here. If you have a bunch of pharmacies you want to add, this is probably the place I would recommend coming to add multiple. And there you go. Then you don't have to do one at a time like you did when you were entering the account. Producers are the same. So we have add more, and then you can just type right here, same thing, at least the first 3 letters. and then you can add those particular doctors in there as well. Okay. The drugs, same as the other, add medication, and then you have this form that you can go through, add medication. You can edit that medication as well if you want to. And then running a quote. Once you enter in that information, just run a quote and then it will take you in there. This enrollment history, this is going to be tied to the direct enrollment. So as you go through and have that application completed, then that will save up right here in the enrollment history. So 2 years now from now, sorry, Allison, you're going to kick me off this call and be like, dude, go get some caffeine. The enrollment history is going to show all of those plans that were enrolled for, so you can go back and look at those. Okay. Now let's talk about scope of appointment. So now that we've gone through, we kind of ran a quote. Now we want to talk to our client and discuss those plans with them. So I'm going to click on send scope of appointment. And there's 2 ways you can do it. If you do your own, if you have your own nice, neat template that you have, you don't have to use our e-signature. You can use your own, and you do that by just clicking upload, and then you can drag and drop right in here, or you can choose that SOA. And then you signify here that that is a scope of appointment. You do have to have a scope of appointment in their file before you can do an enrollment. Okay, so that is a criteria you have to have. I'm going to hit submit. But let's say I wanted to go in and I wanted to do an electronic scope of appointment. So let's do send SOA. I'm going to do appointment date. Let's say tomorrow. Thursday sounds good. Phone, face-to-face, or email. We'll do face-to-face. Select your products. We'll leave dental off just because we know that then they're going to come back and say, I want to talk about dental. And then you have to do a whole new scope. Oh, the love, right? This is the template of what it's going to look like. I'm going to go ahead and click send email. And then I'm going to walk through that process of what does the beneficiary see now as they go through that. At that time, I'm also going to show you the blue button. So I'm going to kill 2 birds with 1 stone with that. Okay. Let's see. Move my cameras out of the way. Okay, I'm going to click sign out because I can't show you this if I'm signed in, because when they do the e-signature, they have to sign into what we call the beneficiary portal, and that will butt heads with my broker if I'm signed in, my broker account. So let me open up my email. And let's do Trusty Select Pro. These cameras get annoying sometimes. Okay, so here is my scope of appointment. So dear Ben, IAD training. These are the items that we're going to talk about. The begin scope of appointment form. These do come in from info@trusty.care. And we do say do not reply direct to this email. We do have people still, even though it says that, they will hit reply. Excuse me. They will hit reply, and then that will create a ticket for us in support. So that's kind of a little added measure we have there, so that when they do that, it doesn't just go to a black hole. We will actually take that and that ticket that's created for support, and we know it's you or who it is because it has the producer name, and then we will send that to you saying, hey, your beneficiary responded to this. This is the email. And then we close the ticket from there. But that way, at least you have that. So there's a buffer there for you. Well, Clay, why don't you just change that to our name and our email address? We are looking at that. We can't, because of regulations and stuff with those, we can't just change that. It has to be tied to us. But what we can do and what we're looking into is changing this to where it displays your name. And then on the back end, it will still be info@trusty.care, but it would be a redirect that would redirect if they do reply and go directly to you as the broker. We do have this little button right here, contact us. And if you look off to the left, bottom corner, it'll say Mel to Clayton plus brokerage prod. That's me as a broker. So they click that and it's going to open up an email, and then it will email to the broker. But a lot of people, they just hit the reply button. So I just wanted to go over all of that with you as well. Now I'm going to click on begin scope of appointment form. This is going to bring up a screen that says, okay, we need to create your account. What it just did in that little brief moment is it went out and it looked for this beneficiary email address to see, is there already an account created in Trusty for this beneficiary, or do we need to create a new one? If this was already created, you would have a login and a password option. You wouldn't have this form. So what I'm going to do now as a beneficiary is I'm going to put in my date of birth. And then I'm going to put in a unique password. And then agree to the terms. Enter. There's my scope. Okay, those are the options we left off, right? And then I'm going to type in my name. And I was going to say something it's not important, I guess. No, this was Ben, right? Ben, IAD training. I'm going to put in the date, today's date. It is face-to-face. And then if this was a representative, they can type their name in there as well. And they also can print this or even, let's see, can they download this one? Not at this juncture, but this, when you do submit, it will automatically save. There's going to be a thing right here. Yep, success. This is now going to be tied directly into the profile for that beneficiary. So you don't have to chase it down. You don't have to have them scan it to you. You don't have to scan it yourself. It automatically is saved in the profile for that particular beneficiary. At this point, they can come in here and say, okay, I want to import my medication from my Medicare.gov. This is the blue button. Or they can enter the data themselves. So when they click this, it's going to bring up this form. Look familiar? It's the same form, right? So they can validate their information here. They then can identify their drugs, their doctors, all of that right here. They are in their account right now. Notice I have 3 drugs. I'm going to go back and I am going to run a blue button import. Those drugs are going to be gone because it's going to be pulling in the current medication from the blue button, mymedicare.gov, that they are currently taking. Okay, we do a 1-year look back. So if they've been on Medicare for 9 or 10 years, we're not going to have 9 or 10 years worth of medication because people come on and off of drugs all the time. So just a 1-year look back. So I'm going to click on import my data from mymedicare.gov. And this is a fake user. This is one that CMS gave to us. So I want to preface, there is no drugs. There is no current plan. There is no Part A, Part B. It's literally CMS gave us a very bare bones because they have to make sure that there is no PHI. And so they legitimately make it not resemble a beneficiary. So this screen is all we need for them to do is put in their information. We're going to hit login. And then it brings us to this page right here. This is something on my computer, don't worry. We're going to come to this page here where it says, do you want to share all of your data or some of your data? By default, you want that to stay share all of your data. The difference between the two is the first name, last name, zip code, date of birth. Those 4 things. I like to keep it on share all because if I fat fingered their name or something like that, it's going to bring that over. But again, this is the beneficiary doing this, so they may actually just click that one. It's up to them. I'm going to click allow. Again, this is my computer. You won't have this. This is now getting that information, importing it, but then also it brought over what we call a token. And that token, that's like car keys to a car. That token is now allowing you to do a blue button import at any time. Okay. Ben, what was that zip code again? I want to change that back.
48375.
Thank you. So see how it did John Doe. So I'm going to change this back to what it's actually going to look like when you do the import. But you're doing all caps. Wait, go back. Well, when you do a blue button import, it's going to automatically do that. It's going to make it all uppercase. And that's another quick way for you to know that they completed the blue button import, is because their name's going to be in all caps. So you can go in here and it will just validate the information again. The current plan will come over automatically. But then save and continue. Notice my medications are gone. Well, that's because that beneficiary, again, it was a dummy from CMS. There's no medications on it. So you would add those medications here, or if that particular medication list came over, then that beneficiary can go in and they can add, edit, remove, whatever they want to do to that. Once they're done, they're going to click done adding medications. Remember, as a broker, it was taking me through the quoting process at this point. It doesn't do that for the beneficiary. That's it. So now it says, hey, great, your contactor or your broker will contact you. Give them a call if you need to, and then they just hit log out. This is that login screen I was telling you about. They can bookmark this screen if they ever want to go back in and do that. They can log in anytime. Okay, so now at this point, I'm going to close this tab. And then I'm going to log in as a broker again. Allison, before I get going on anything else, is there any questions that came through?
Mm-mm.
Okay, cool.
But feel free to come off mute if you all have any questions.
Yes. Okay, the other thing in here, once I completed that blue button, well, Clay, how do I know that they completed that? Over here on the right, you have this little bell with a red dot. And that red dot will show when something has been done from the beneficiary portal. Okay, so I click on this. There it is. There is Ben. He did his SOA. He did the blue button. And then he also updated his profile. Because you remember I updated the name and the zip code. So I did all three of those. I can click into this and then it will take me into his profile. Now take a look over here on the bottom left. Do you see anything different? Allison, do you see anything different?
On the blue button?
Yes.
Mm-hmm.
Good job. So the blue button is now illuminated. Okay, it was grayed out because remember that car key I was telling you? So now I have a car key, that token, and I can actually do that import at any time I want to now. Okay, so this year, if you're doing this, you can send that medication update email. They go through that, get that token passed. And then next year, you don't have to do that. You just go right in here, click blue button, do their medication. We want their pharmacies. And I'm going to sync. And then it pulls it in, right? Of course, I don't have any medication, but it would pull all of it in if I did. Pretty neat, right? Let's see. The other option, if you have a client base, and this process is one that I think quite a few brokers use, you're going to have some of your clients that just aren't tech savvy. Clay, they're not going to be able to go through all of that. Well, you can do it on their behalf. Remember, we had that power of attorney, and I can show you how that works as well. How are we doing on time, Allison?
You're doing great.
Awesome. Okay, I can show you power of attorney then.
Yeah, I'd show them all this stuff. Mm-hmm.
Okay, so if they are not tech savvy, you can actually do that initial update on their behalf. So this invite is going to be that same invitation where you can copy that link right out of. Okay, so I can copy that link, and then because I'm logged in as a broker, I'm going to go to incognito. You won't. Okay, there you go. So Ben IAD training. So that link right there takes me back into that portal for Ben. Okay, and now I can go through that as the beneficiary. If there was not an account created, it would take me to that account creation tab. So then you can move through that on behalf of your client. Okay. The power of attorney. So let's go through and let's do a power of attorney for Ben. So I'm going to go in here, actions, email, blue button 2.0 authorization, send the email. And then that's going to send an email to the beneficiary saying, hey, let's complete that. Let me go into my email, move all my cameras out of the way. There we go. So agent support, please sign this document for your broker. Okay, so this kind of explains a little bit about what this document is. By signing these, you're going to help. That's just my brokerage name, but it would actually be yours. So don't just replace that with your name. Then I'm going to click on review document. This document is DocuSign, so they can do this from their phone if they want to. I agree. Continue. It's going to have all the information filled out on there. And then they can actually sign this at that moment. Okay. This is their email address they're going to use for my Medicare.gov account if they have one. But if they don't have a my Medicare.gov account, all the data is there. So it's not a matter of, oh shoot, they're not going to have any data. They do. Anytime they use their red, white, and blue card to fill a prescription or anything, their account's created. It's there. But they notice there's no password. That's because you don't ever want to have the login email and a password together. You would have to pick the phone up and call them and say, okay, what's your password on that? I'm going to go ahead and sign this. This is a normal DocuSign stuff there. And then I'm going to hit finish. Before I hit finish, I just want to point out this, if you wanted to do this on your own, what we can do is I can take this form and I can have Allison send it over to Ben. And then you guys can take and you can copy word for word what this is and put it into a Word document or something and make it your own. It's just the wording. You won't be able to change the wording. It has to be exactly like that. It's gone through all of our attorneys and everything else, but you're welcome to make it your own if you don't want to do the DocuSign piece. So I'm going to hit finish. And now at that point, it's going to send an email to me as the broker saying this is complete. This is a DocuSign screen. We can't change that. So now I'm going to go to, I'll close that, go back into my email. And this email here says completed. Ben IAD, view the completed document. And there it is. Okay, so then you can download this. And then you can save that up into the profile. Okay, so how I would do that is I would come back into Ben and IAD training and document repository. Upload. And there you go. It'll just load right up in. Okay. Notice there's the scope that I just showed you. So that saves automatically as well. Okay. And that will download if you wanted it to download. And this is what it looks like. Okay. Any questions on any of that?
I don't see anything in the chat.
Okay. Either I'm boring everybody or everybody's like, dude, like a California surfer, dude. Okay. Let's talk about enrollment. When you go through and you've completed everything, you've met with your client, you're ready to enroll, click on actions, enroll, and then it's going to bring you to this screen right here where you can start the application. This actually, it's not going to work, so I'm not even going to click on it, but this will bring you to this screen here where it just confirms the information, which plan you saved, and then you can start the application from there. And what that looks like, if I could, let me go back over to this page because I do have a screenshot of this. So when you go in, you're going to have a page that comes up like this. And this is going to show all of the information. There's 4 pages. You go through, fill out the contact information. This is going to pull in all of the information from the profile of the beneficiary. As much as you have entered is what's going to be entered. And then you have the benefits info, other info, and then your review and submit, where then they would, from their tablet, they can do it from their tablet as well. They can sign it with their finger or use their mouse. And then that would automatically get sent to the carrier. So what happens in the back end is all of the plans, all of the applications that were done during that day are batched up like a batch of apples. If you're a farmer, Clay, that was a dumb analogy. Just roll with me. But it's batched up together, and then it's a bushel of apples. Thank you. It's a bushel. And then that will send out to the carriers that night. So typically they go out at like midnight or 1 o'clock in the morning. And then you would then follow up with the carrier for what that status is. Did they approve? Did they reject? Here are those messages, those in progress, sent to beneficiary for signature, submitted, and then complete. Okay. Once the enrollment has been submitted, so that's when it's packaged up and sent to the carrier, then it's going to say submitted. Okay. Any questions? I know that I didn't get to go through every piece of that, but that's kind of how the enrollment process will flow once come next week. So I do want to say, after you go through and you do the application, the beneficiary is going to be presented with a health needs assessment, HNA or an HRA, and they can fill that out right then and there, and then it will be submitted electronically to the carrier as well. Any questions on the enrollment? Okay. Concetra, are you still there?
Yes, I am here.
Would
Hey,
you like,
before you
yeah.
do that, did you go over their dashboard and like producer profile dashboard?
No, do you want me to do that now?
I would finish this up before you have her.
Okay. That'll give Concetra time to wipe the sweat off of her brow, because I'm surprised her that she's going to train on that. Okay, so on the left-hand side, we do have a few options here: profile, dashboard, beneficiary list, batch processing, and then help. Help will take you out to our customer support portal, where you can log in and you can search for knowledge articles, watch videos, so on and so forth. Ben is going to send out this site, though, that I was just kind of showing you. And this is a really good resource for you as well, because it's got everything out there. Allison's going to talk about this in a moment. But that's what the help does there. The profile, this is where all of your producer information is stored. So if you're looking at your information as you send it out to your clients and you say, oh man, my phone number is wrong, just go into your profile, click edit, and then you can edit that phone number there. Street address as well. If you noticed in a lot of mine, I didn't have a street address, so I probably need to put in a street address. Okay. A city, state, zip are really important. The carriers and plans, this I have every single state selected just because I work a lot of support tickets and it covers every different state in the country. So I select all of them, but you can select just, let's say, where's Michigan? Michigan. Oh, I don't know. Sure, we'll do Florida. Update. And then that's going to give me all of those plans. This is where it's a little bit interesting. So I
But
will
they can't
say,
do this individually, right?
yeah, they can do the add state. What
The
they
states, but
can't
not,
do,
yes. Okay.
yeah, they can't do this part right here. So what Allison was saying is right here, you can add your own states here all you want, but the issue here is you are not able to enable these. Ben needs to do that, or a member over at IAD, because they are the upline. But what happens here, if Ben, which he already said, you guys can quote for everything, this is going to sound a little bit backwards, but just go with me here. When these are all marked off like they are right now, you can quote for everything. So Ben is going to actually leave that turned off like that, so that when you add a state, you don't have to go back to Ben and say, okay, I added Idaho. Can you go in and turn on all my plans for Idaho? You don't have to do that if everything is turned off. The minute you go in and you say, okay, I want Advantage, and then I want Aetna, MAPD, PDP. The minute you do that, you're being very selective on what you turned on. So if you add a state, it will by default be turned off, and you will not be able to quote for those until you have Ben turn those on for you. Okay. So that's kind of how that works there. Again, you're probably, if you want to just quote for everything, just keep everything off. And then, like I say, Ben, just kind of instruction for you as you're instructing people, then what they can do is they can just add their own state, and then they don't have to bother you to get quoted or to allow the quoting. Does that make sense?
Yeah, I just leave it on off so that way they just always have all of them.
Right.
Perfect. Exactly. This right here, all this is, you guys, is just a filter. This doesn't mean that you're only going to be able to quote for MAPD or PDP. It's just a filter as you're going through these plans right here. So let's see. The other thing that we want to talk about is the producer dashboard. So as you go through AEP, metrics are kind of a thing, right? So seeing your statistics. So dashboard over here on the left, and then this is going to give you all of this information here. Let me actually open up my date range. Let me go back to 2020. Holy cow, I've only done 142 over the last, okay, I got to get to work, guys. So this will give you your submission summary as well. Notice there's dental and off marketplace and stuff. Pay no attention to that. That's going to be coming off. That was for a other project that we were working on. So that'll come off. Same thing with the agent live proposal and email status. That was for a another thing that we were working through. But this will give you the application status. So I have one application, and none of those are submitted. So this is going to really break that out for you so you can actually see what's going on. Your activity history, again, you can see what's going on there with your activity history. Not a ton of people use this, but it's there in case you need it. When you view this, you can narrow down the activity by clicking on the funnel. You know, if you want to see what all SOAs are done within a specific time frame, you can do that, and then it tells you that. Okay. The other thing you can see is all the notes in your system for every single beneficiary. So you don't have to go through one at a time and view the notes. If you put a bunch of notes in for a specific time frame, you can just look at them all at once right here. And then you can even search for the beneficiary name here as well. Okay. Any questions on the dashboard?
Mm-mm.
Okay. Batch processing, and then I'll turn it over to you, Concentra. Batch processing is a really neat feature where it allows you to run a quote for all or some of your beneficiaries. The key component here is making sure that you have their current plan entered and their medications. If you go through and you do that hard work right now, you go in and you're putting in all their current plan, their drug information, then come October 1st or a few days after or whatever, when all the plans are totally dropped. I know they're supposed to be on October 1st, but there's some where it's like, okay, update your stuff, come on. Then what you would do, if you've done all of that work, you come into batch processing, and then you will have all of your clients here. But notice the quoted plan is gone. This is only, all we care about here is the current plan, because technically you haven't really ran a quote yet, right? You've just been working on getting their current plan and their medications. That's it. And then you're going to have the system run this batch process for you. So we're going to look at the current plan. We're going to select all or some. You can select just a few if you want to, or you can start the plan batch by a specific type. So you want to run it for all PDPs, you can do that. MAPDs, you can do that as well. But I'm just going to run it for Ben here really quick, because it takes a minute to run all those. But you can do it for all of them. And then what it's going to do is give you some results here. So you can see Ray from Tucson, Humana Basic is the current plan that he's on. Well, we're recommending that you change that plan. When I click those three dots there, this is the template that Ray will actually get when I email this. But we will actually say, okay, and this will say 2023 once we're done with our refresh. The current or the recommended plan is SilverScript. Well, you're on Humana, you're paying $95 on that when you could be paying $22, and the premium is less. So you need to change your plan. They do not have access to this click here to compare other plans. That is only for you as a broker. That disappears on the email that goes out to them. So there's the change in plan, and then we have the new plan. So if there is no plan at all, or they have moved to a new area where that plan that they were on is no longer there, they need a new plan, right? The new plan will say, we've completed your drug plan review, and it's going to give the lowest cost and then the next lowest cost. Okay. Again, they don't have that compared to other plans. The big one that I want to point out is the stay-in plan. Let me see if right there. So Bruce Lee is saying he needs to just stay in his current plan, no action needed this year. So the recommended plan is SilverScript Smart RX. So last year he had the same plan, and this year calls for the same plan here. So that plan is the cheapest plan and the best plan for him. Okay. So, well, what does that mean for me, Clay? Well, if you have, let me refresh this screen here really quick and see if you're done. Okay. So if you have, let's say, 500 beneficiaries and 250 of those are PDP plans, you have to go through every single one of those PDP plans, run a quote, compare, and then it just comes back where, oh, well, they just need to stay in their plan. Let us do that in bulk for you, because we'll run that, and then you can send that email, that template that I sent you, by clicking send email to every one of those stay in plan flags. Send the email. I'm going to get an error because some of these don't have email addresses, but that will then send that email to your beneficiary saying, hey, I did your review. You're good right where you're at. It takes that weight off of your shoulders. So now you can focus on getting new business, or you can focus on your MAPD plans. You can do this as well for the new plan and the no plan. Those are probably my two Clay recommended ones that I would go in here, run the batch, and then get those off your plate right away, and then just move forward. Okay. Any questions on the batch processor?
I don't see anything.
Okay. Ben, are you guys doing the Ring Central call recording?
Like, what do you mean? Like, are
I
we?
mean, I think it's open to anybody, but they're
Yeah.
not
Okay.
just
So
like
we'll go over
everybody
that.
else. Yeah.
Okay. Let's go over that really quick. Concentra, can I have you go over that?
Absolutely. I'll go ahead and share my screen.
Okay.
All right. Okay, so we are using Call Central for the call recording process. And what will happen is if you don't already have a Call Central number, you would basically, when you log in, everyone is going to see this message here. And then if you don't have a number, you need to get a number assigned before you can utilize the service. So you would click here on the help, and this is going to take you to our page, our help page, where you can actually submit a ticket for the number. Once the number is assigned, when you log in to Trusty Select Pro, you will see Ring Central down here, and then you want to open this up, and it's going to prompt you for a login. So when you get your number assigned, you'll get a login, and this is what you're going to enter here. So you sign in.
I think you have to, yep.
Yep. Change this.
I need to resave.
All right, let me bring this over here.
What are you looking for?
Hold on. I need to bring
Okay.
this because you can't see the window. It's on my other screen. I have two screens up.
Oh, I
Yep,
just see your mouse moving.
hold on one second.
Okay.
Type of day. Okay. All right. Okay. So can you see me now?
No. You have to
Okay.
check. There we go. It's coming up. Yep, I
All
can
right.
see.
Okay. So once you select your sign in here, you're going to get this screen and your login credentials will show up, and you just next on the next screens here. And then this is going to bring you to the page to authorize. And you just select that and accept. And then it's going to bring you to the dialer pad. This is where you will make your outgoing calls to your customer. So you can either enter the number through your keypad on your laptop or your device, or you can type in the number here directly from the pad. So I'm just going to make a call here to myself. And then just select the green button to start the call. If you're going to use your keypad and you type in the number here, then you just select enter. Now, once the call's answered, you can start recording. We'll just select the record button here.
This call is being recorded. If you do not wish to be recorded, please disconnect at this time.
Okay, to stop the recording, you can either select stop, and if you forget and you hang up, then the call recording would be stopped at that point.
This call has been recorded.
Now, all your calls and all your recordings are going to be kept in storage in Ring Clone. That's a separate login, and that site is accessed through the URL appringclone.com. So this site will take the same credentials as Ring Central. So this is where you come in if you need to go in here and pick up one of the recordings and upload that recording into Trusty Select Pro. So you would come in here with your credentials, and it's going to bring you to this page. And up top here, these are all your options where you can select and narrow the specific call to do your search for a specific call. So it's going to basically show up here for everything that you've done in Ring Central. It's going to be logged here. So if your contacts are listed with a name, then that'll show up here. If it's just a number for that contact, then that number will show up. Under files archived, this black box here is a representation of a voicemail. You can actually select this and listen to the voicemail.
This call is being recorded. If you do not wish to be recorded, please disconnect at this time.
And then if you want to download this call, you can download from here and then upload it into Trusty Select Pro. If you have multiple calls or recordings that you want to download, you would just select those specific calls and then download and then upload them into Trusty Select Pro. And that's basically it for Ring Clone. Again, this is going to be where everything is held in storage, and this is going to be accessible for you at any time to access if you need to get in here, if you want to listen to a recording, or if you want to, as I said, bring that recording over to Trusty Select Pro to add to the beneficiary record. Any questions on that? Any questions for the Ring Central?
Hey, Concentra,
Mm-hmm.
how do they get their account, like that login stuff that you showed initially? Where does that come from?
Okay, you're going to select the help. This is going to take you to the Trustee Care support portal. And then you would submit a request. And then that request is going to come to customer support, and we will assign a number.
How much does it cost? Is there a fee?
Yes, the fee is there's a setup fee of $75, and then there's the monthly fee between $25 and $30. Also, I just wanted to add that once you log in here, You can minimize this window, and if you need to make another call, as long as you have not actually logged out here, you won't need to re-log in. So you'll stay logged in. Even if you log out of Trusty Select Pro, when you log back in, your Ring Central login will still be active. What were you going to say, Clayton?
That call recording thing over on the right, that blue box right there.
Yes. This is just a notification letting everyone that logs in that if you don't have an account to make your calls, to do your recording, what you need to do, and also to get rid of this, because this is going to show up every time you log in. If you don't want it to show up, then you X out. Once you X out here, this will go away, so you won't see that again. Also, this can be moved around the page. You can minimize it and then move it around. Relocate it wherever you need to, so it's out of the way.
Any questions from anybody on Ring Central?
Sorry, I responded directly to somebody. There's a question about the archive. So all the calls are made and received through Ring Central, and the recordings are saved in Ring Clone. On Trusty Select Pro, we just have integrated a widget to link to these sites, but they're saved on Ring Clone.
You can download them and upload them into the profile within Trusty to keep everything together if you would like to.
Are there any other questions on Ring Central or Ring Clone?
Cool. Thanks, Concetra.
All righty.
Allison, I think I've covered everything on my side. Do you want to talk through the onboarding site?
Yes. I don't have it pulled up.
I do.
Okay.
You want me to share?
Yeah, that'd be good. Okay, so we've got two resources available to you for getting started on the site, training and troubleshooting and things like that. So this first one right here is our onboarding site. It does not require a login or anything like that to access it. It's just, you've got to have the URL obviously to find it. So can you click on the, yeah. Okay, cool. So there was that magnifying glass on the top right-hand corner. So you can search by keyword. So you can search by keyword and it will bring up.
It would help if I spelled it right.
It'll bring up any of the articles or topics that have that keyword in it. So that way you can quickly search through the whole site if you can't remember which category it's under. So let's go back. So it does have right here on the before you start several documents just about using Trusty Select Pro. This is just a summary of the benefits of using it. This explains our drug pricing, how we get that information. And then this right here is another one pager. It's similar to the one that I showed you on the intro slide, but this is just kind of walking you through the phases of what you should be doing in preparation for AEP. And so that way you can run those batch processes and get starting on quoting in October. So this logging in right here is for anyone that has a newly created Trusty Select Pro login. So that's why we call this our onboarding site, because it does walk through all the screens that you'll see in your email. And then when you start clicking on those things to get your account set up in Trusty Select Pro. Okay, so in these categories down here, go ahead and just click on one of them. So this will go through all of the topics that Clayton and Concetra walked through. It's just kind of resources for it. So there's videos within them. There's also screenshots with the text directions to the right if you are not in a place where you can watch a video, but we've got every single topic that we talked about today in here. Okay, let's go to, do you have the other site pulled up?
Which one?
The actual support portal.
Oh. No, but I can.
Okay. So like he just clicked right there on the question mark to the left. That will take you directly into our customer support portal. So this one does require an account. So it is a HIPAA compliant site, because we do in our support tickets a lot of times ask for you to provide us screenshots so that we can try and recreate those issues. So you can, if you don't have an account, when you click that question mark button, it'll pull up a login screen, and there is a button that says, new to Trusty Select Pro, create your account. And so that'll let you create your support portal account. So right here in the middle, just like the other site, there is a keyword search. So you can type in what you're looking for. It'll bring up any videos, articles. If someone has created an enhancement request for something that they feel like would improve the experience, it'll pull up anything related to that topic. Okay, let's go into our training video repository. So this will take you straight to our Trusty University. And so this has it broken down similar to that onboarding site, step 1, 2, 3, and 4, just kind of how you would flow through the process. And this has videos where most of them are Clayton walking you through actually in Trusty Select Pro, completing these tasks. On the bottom right, where it says Learning Labs, I've had some questions about if we're having more of these or just how to access this. We're posting, we are having some live Learning Lab sessions that are open to everyone, all of our users. So we're providing our training sessions that are specific with IAD to Ben and Jason. But right here, these Learning Labs, we're also having I think 4 of them leading up to the first week of October. And so those are posted right here. Those are an hour long, so it's a more condensed version of this material, but same walkthrough. Okay, let's go back. And this knowledge base right here, where the other one was all videos, these are articles. So it'll just walk you through step by step any of these issues that you may be experiencing, or, you kind of come up on a roadblock and you're not sure what's the next step. All that information is in the support portal. Okay, so here in community, this is really important. We've got 2 topics on here. The feature requests are on the left. Go ahead and click on that, Clayton. So this is some recommendations, suggestions, different things like that for all of our TSP users. So you can, submit these in here. We really do ask for your feedback while you're using the site to how we can make it better for you. So as those things are being worked on, we'll tag them. You see that all these say completed. The other ones, if you're not sorting by this, I think say planned. So we had like call recording and some different things like that were in that planned phase. And then as we roll them out, we'll change them to completed. But when you are searching by that keyword, it will bring up if there is a feature request for that item, so that way oh, okay, somebody else has requested it. I think that this is something that we absolutely need. And so that's where he's pointing right there on upvoting it, because we do take these recommendations, these suggestions, and use this when we go back to our product team for new features that we're rolling out in the next year. Okay, let's go back into the community. The most important thing I feel like is these notifications and critical alerts. So on the right, kind of in the middle to the right where Clayton's is selected to following, you'll just click on, it'll say follow. And so that way you'll get an email and it will let you know when there is a new notification or alert. We cleaned this up just recently, but there's we'll post on here if our hours have changed in support for a holiday, or if the site's going to be down for a short period of time because we're pushing out a release. And then also when we are pushing out those releases, we will post on here so you'll know what the new features are. So you can click on that one, Clayton, the what's new in Trusty Select Pro. So we'll tell you everything that's just been released in the site. So that way, if you log in and it looks completely different, or if there's a new option on there, this is a great place to check and see what those features are that have changed. Okay, let's go back just into the main page. Okay, so up on the top right where it says submit a request, if you are running into an issue that you've typed in and looked for the articles or videos and you still can't figure it out, it might be a bug or something that you feel like just isn't working right, you can't get it to process something correctly, then you can submit a request in for our support team to help you with some troubleshooting. So there are some fields that you'll have to fill out in order to submit that request. There's a box at the bottom for attachments. That's the most helpful thing if you're running into an issue, running a quote. So we want to try and recreate those issues. So providing us with a screenshot is the best way. That way we can see the zip code that you're running it in, what the actual screen is showing, all that information. This is key, is these attachments are the most helpful. Okay. Yes, so if you go to my activities, so if you've opened up support tickets, it'll show you right down here the status of them. So once it's submitted, it'll be open. If we're have emailed you back and we're waiting for a request, what does that one say, Clayton? I can't remember.
Which one?
If you all have ask them for more information.
Oh, it'll say waiting for you.
Okay.
Waiting for a response from you in blue.
And then all the solved ones. So you can see right here any of your tickets that are just in progress, but you'll get notified through your email that there's been an update to your ticket as well. Okay, what am I missing on here, Clayton?
These are just contributions. What have they contributed to, if they wanted to see that? And then following, what exactly they follow. And they can unfollow those in bulk. That's really all that is.
Okay, I'm just talking about what am I missing on the whole
Nothing.
site.
I think you hit everything on there.
I think so. Okay. Any questions on either the onboarding site or the support portal?
There's a question from Barbara. She said, can you please show again how this can be used for CRM? Barbara, are you referring to CRM, call recording management, or something else?
No, she's probably talking about in TSP.
Like notes.
Mm-hmm.
Okay.
So when you come into the profile, you have the option right down here for adding notes. So that's where you can add those particular pieces here.
So you can maintain your notes, you can maintain their, on the left-hand side, all of their demographics, so their address, their birthday, all that information. And this is where that MBI will be stored when we push that release.
Does that answer your question?
Yes.
Yes. Yes.
Okay, cool.
Do we have any other questions in Trusty Select Pro?
There's a question. Is there a cost for this, or is it paid by IAD?
Are you
Ben, you're up. Ben.
Yeah, but are you talking about Trusty Select Pro or call recording, David? You can come off mute if you want.
Well, I'll just cover both.
Yeah.
Trusty Care Select Pro is covered by IAD. The call recording is separate, and that will be agent to agent costs covered.
Cool. Any other questions out there? Okay, so like I said, the recordings that are IAD specific, we'll send to Ben and to Jason, and then the live learning labs, the ones that are just an hour, those are posted on the customer support portal. Just a reminder that the support portal is a separate website from Trusty Select Pro. So a lot of times people will open them up in two different tabs, so you can toggle between the two, especially as you're beginning to use the site. So that way, if you need to look up, how to enter in some sort of data or anything like that. So those are two different logins. You can make them the same, but they're on two different sites. Okay, I don't see anything else out here. If you all do have additional questions, you can, reach out to support portal, see if there's something that they can answer through there. If it's more specific, like cost or something like that, of course, would, go internally. But I think that's all. That about wraps it up. Thank you all for joining today.
And I'll be sending out an email to everybody that was on today with some information that Allison provides to me. And this webinar will at some point be on our YouTube page.
Cool. All right. Thanks, everybody.
Thank you, everybody. Bye.
Bye-bye.
Thank you, guys.
You're
Thanks.
welcome.
Okay.